Welcome. This presentation will discuss nursing scope and standards. The main purpose of professional standards is to direct and maintain safe and clinically competent nursing practice. These standards are important to our profession because they promote and guide our clinical practice. The American Nurses Association, ANA, is responsible for developing and maintaining the scope and standards of nursing. The ANA defines nursing as the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. The definition of nursing lends an insight into the scope of the nursing practice and the standards of practice. The standards are subject to change with dynamics of the nursing profession, as new patterns of professional practice are developed and accepted by the nursing profession and public. The answers to the questions of who, what, where, when, why, and how are compiled to provide guidance and boundaries to nursing responsibilities and provide the authoritative statements in the 17 standards of care. The scope of practice describes services health professionals are competent to perform in conjunction with their professional license. The ANA describes the scope of nursing practice. The standards of practice serve as minimum guidelines identified by the profession and healthcare organization policies and procedures. Policies and procedures are implemented to assure competency and consistency in clinical practice, while providing care and education. The standards of practice also promote safe staffing practice, documentation guidelines, and allow for accountability of decisions and actions. Protections to patients is promoted by the standards of practice. Patients can expect to receive safe, quality, and competent care from nurses who practice ethically, encompass cultural diversity, are current with practice, and collaborate with other healthcare professionals to provide the best possible outcome and minimize exposure to risk and harm. Each of the 17 standards expands on the direction and metrics regarding the scope of practice. The standards of practice. The first 6 standards are based on critical thinking and the nursing process. It is the foundation of the nurse's decision-making. The standards of professional performance are the remaining 11 standards, which speak to the competency level and behavior. Registered nurses are accountable for their professional actions to themselves, their healthcare consumers, their peers, and ultimately to society. The standards of practice include the assessment, diagnosis, outcome identification, planning, implementation, and evaluation are core skills in critical thinking. The standards of professional performance, ethics, culturally congruent practice, communication, collaboration, leadership, education, evidence-based practice and research, quality of practice, professional practice evaluation, resource utilization, and environmental health. These speak to competency level and behavior. The nursing process and standards of professional nursing practice, as depicted by ANA, shows how the standards is interwoven with the next and as a whole is centered to promote the best possible patient outcome. The model of professional nursing practice envisions nursing practice as a 4-level pyramid building toward the outcomes of safe, quality, evidence-based nursing practice. Building on the base, each level of the model incorporates progressively specific laws and guidelines that govern practice, cultivating, and self-determination. Within laws and guidelines, the professional nurse plays a role in determining his or her own practice. The Nurse Practice Act is different from the nursing standards of practice. The NPA is a set of standards written by the Board of Nursing, defines the professional standards of nursing practice. Each state has its own unique Nurse Practice Act enacted by its legislature. Each state then defines the practice of nursing and determines whether nurses stay within their scope of practice. BNPA, education program standards. Entry and graduation requirements. Protects patients by defining and regulating the nursing practice, and sets requirements for licensure and grounds for disciplinary action. I hope this has been informative. Thank you for watching.